Influence and control are often outside of the client's awareness, and yet it's such an important part of their day-to-day functioning. And by you helping them identify when there's either too much control or too little control is actually very often at the heart of their problem. Welcome to The Art of Therapy, Season 2, Episode 16.
Yeah, so we're going more and more into depth of the art of therapy and looking at principles and variables that's really important in mental health.
It's so much because it is an art, and the more you understand some of these principles, the more that you can see, and the more rewarding it is because the more people that you can help as a psychotherapist. So it's really something.
It really is.
Yes.
So just to recap, so in the last couple of episodes, we really started to have a look at what is those principles that's important in conflict resolution and how a therapist can observe that with their client and then the significant others in that client relationship. And the ones that we looked at is the circularity, the metacommunication, and then lastly, the problem-solving skills. So really understanding how much goes into problem solving. In what you mentioned the previous time is really accurately describing the problem, looking at what causes the problem very objectively.
Yes.
And then looking at solutions very systematically and logically.
Yes, very much.
Okay, so then we said that we're going to have a look at a difficult one today, and that has to do with around control and exploring that in relationships.
Yes. Yeah, we said it's a little bit of the bitter bit. It's a difficult one because for many, the idea, the notion of control is unacceptable, is considered not indicated or relevant. And it's also can be quite uncomfortable. So for our purposes, therapists, we need to clinically look at the issue of control because it relates very much to mental and emotional well-being. So in terms of control, what is important is to what extent is the individual able to have influence on their environment and others? To what extent can they orchestrate their environment and do so effectively? Or do they have difficulty with that? Do they tend to respond in a powerless way, in a helpless way, in response to other people, the demands of the environment? So what we're looking at here is how does someone relate in terms of control? What's their capacity to appropriately have impact, have influence, and where appropriately to yield? Because we also need to yield at times in terms of control.
Yeah, it is. It's a hard one. It's like you said, it's at times can be a bit of an uncomfortable one to look at. But I think it just goes back again to it's not wrong or right. It's actually just what is the effect of control, and when is it appropriate and helpful, and then when is it not actually.
Yes, it's so interesting. You note that can be uncomfortable, perhaps even unpleasant to talk about it, and yet most of us. As people and as most human beings can quickly articulate something around the impact of control. You said it's around the impact. It's not wrong or right. How do we experience it? How do we experience it on the receiving end? How do we feel when we get more of what we want? We're more in control or more persuasive, or we've been heard. So most people actually intuitively have a sense of control and what it means, but somehow it's often difficult for us to talk about control almost like it's a little bit of a dirty word or something we should ignore. But no, clinically, it's part of interaction, it's part of life. And that's really important for an individual to be able to express and have influence and yield appropriately. It's a very big part of life. And so the therapist, it's essential that the therapist pay careful attention to how the client utilizes or shows and expresses this or the lack thereof.
It reminds me that my sense is almost that it's on a social basis, it has a negative connotation.
Yes.
But when it is on a clinical perspective, it actually plays a massive role in our mental health.
Yes.
So it's important to look at it and to understand it and being able to describe it, because it can relate to why a client comes to therapy.
Yes, so much. If we just consider the case of someone where if the presenting problem is that they feel very down or they feel depressed, and the therapist observes that in their interaction they tend to show very low influence, not be in charge of their environment, and respond in a rather passive way, often giving up in the face of demands or feeling unmotivated, or certainly expressing that, and really responding as if they're a victim, that they're powerless, helpless. Well, we know that's going to be linked to depression, because it's that golden triad again with depression, that the first quality or one quality is isolation, when the individual's isolated. Second quality, when there is repressed or let's say suppressed anger. And then finally, when they are effectively powerless, when the individual is isolated, where they're unable to congruently express anger, and that they're effectively powerless, we know that depression is going to show up. So yes, if the presenting problem was around depression, the issue of control will need to be looked at very carefully. It's in all instances when one's observing and working as a psychotherapist, want to note control. But here we're just looking at it, how clearly and quickly it links to a presenting problem. So control is, and being able to observe and describe it, as unpleasant or uncomfortable as that is socially, clinically, it's absolutely essential.
Hi, it's Marizaan, and I would like to tell you something extraordinary happening at Treatment Works. So if you are a healthcare professional and you would really like to deepen your therapeutic skills, training with Dr. Phipps is a must. In my experience, his training is so compassionate, it has high clinical excellence, and it makes therapy so clear. Training is also not just a space to learn, but it's also a space to connect, to share with others and learn from others. So if you are ready to deepen your therapeutic skills and to look at more ways to support your client, join us for training at Treatment Works. You're welcome to visit our website at treatmentworks.co.za.
It's really important.
It is.
And I think what comes up for me as well is that it's really about what the therapist sees. So it's not what the client always reports, and because the subjective experience might actually be like, yo, but I'm not in control and I'm not experiencing this. But if a therapist looks back or takes a step back, they can actually see that the client is actually having a lot of influence over the environment. It might be on their terms and how they want it to happen. But then in that, feeling like they're not in control, but they are actually exhibiting a lot of control over the environment.
Yes, this is really important. I'm so glad you've clarified it, because one's own perception of control, and to the degree that one is in control, very often doesn't actually align accurately, doesn't correlate with our behavior and what others will observe and note. So when we're looking at control clinically, it's important to realize this is very different from what is sort of most often referred to as locus of control. Locus of control has to do with the individual's subjective perception of whether they're in control and to what degree they're in control or not in control. And what we're looking at, that's meaningful in and of itself, but we've got to pay careful attention as therapists to what is someone's capacity to be effectively in control. And someone can be overly controlling and excessively controlling. That's not going to be effective. They can be overly yielding when they shouldn't, or when I say shouldn't, it's not a judgment, it's just where it's not effective, where they actually need to have more impact, have more influence, have more say, where they actually need to express a high level of control. So one wants to look very carefully at this, both in terms of how the client relates and with their significant others. And of course, always the other part of this is how they're relating in the therapeutic relationship. And always, how does this relate to the presenting problem?
Yes. It's all. I think that's such an important distinguishment to do, because I think it just, for me, when I started with this, is I viewed it as locus of control, but it's not that. No. It is, because it can be very different than from what the therapist actually observes.
Yes, if our perception and our subjective was always accurate, that'll be fine.
Yes,
but it's often not. What we perceive is influenced by how we're feeling, our emotions, our beliefs, our values, the way we want to see the world. So at times it's not. I mean, very typically someone who's very comfortable with control and very much in control, and perhaps even if we take that further, is disproportionately in control, where it's not appropriate or effective, often wouldn't recognize just how forceful, how controlling they are. And if you give them feedback to this effect, they can be really taken aback. Because again, so often we're just reacting. We don't step back and always register impact and how we're relating. So someone who's in that position often won't realize to what extent they're really forceful.
Yes.
At times can be extremely controlling. They just have no idea. And equally so, someone who may not be effectively in control. Therapists are typical of this. If you ask a therapist, are you in control? Are you managing your environment? Yes, they'll tell you. But if you look at how they're relating, often accommodating, not speaking up, with their empathy always going to the other, what are their needs and the needs of others. Just because one chooses to do that doesn't take away from that maybe I'm not being sufficiently in control, having influence. So it works both ways.
Yes. Yes. Yeah, I think the control principle, it really is one of those where you have to get exposed to it over and over and over again. Because just from my own experience is that I was trained in this in masters and I thought it made sense. And then every time I do training with you, it just becomes clearer and clearer, and you're able to more accurately see it and being able to describe it more. So I do think it's one of those principles that you understand it and then it comes a bit fuzzy, and then the more experience and the more exposure you get to it, the more clear it actually becomes each time.
Yes. I'm so glad to hear this, and I appreciate what you're saying. It requires a lot of thinking about this and observing, and you get it, and it's so simple, but then it's not so simple. And as you explore this and as you work with it, you realize how nuanced communication, and specifically the aspect of the communication of control and in terms of impact, how nuanced that is.
Yes.
So there's an enormous amount to learn. Yeah.
Yes. Yeah, okay. So having looked at control, it just makes me think there must be more. There must be more that actually a therapist can look at what contributes to our mental health. And so I'm going to check with you. Is there more?
Yes, certainly. We actually touched on it just now.
Okay.
When I noted that control can be, it's context specific. There are times where it's indicated to express a high degree of influence, control, and other times where one needs to yield. So control is neither good or bad, wrong or right. Neither is lack of control good or bad, wrong or right. It's all context specific. So that relates to degree of fit. And it's a very special concept that has to do with flexibility.
Sure. Okay. I'm looking forward to looking further at this with you in our next episode then.
Yes, I share that.
Thank you for joining us on the Art of Therapy today. We hope that you find this conversation really thought-provoking and meaningful. And if any of the aspects really resonates with you, please feel free to leave a comment below. Thank you for walking this journey with us. Until the next episode.